Assalamualaikum viewers and welcome back to our channel. Today in the playlist of oral and maxillofacial surgery, we are back again with another important topic of odontogenic infection, that is the buccal space infection. So as we have discussed every facial space infection in the following headings: boundaries, contents, source of infection, spread of infection and clinical features. For the management, we will make a separate video so you can refer on to that video to have in-depth learning of the management underlying the principles and guidance of the management of odontogenic infection or any facial space infection that arises due to the odontogenic infection. So moving back to our topic, buccal space infection. The boundaries include: medially it is bounded by buccinator muscle, we can see in the diagram as well. Laterally, skin and subcutaneous tissue. Above we have the zygomatic arch and bone, and inferiorly we have the deep cervical facial attachment to the mandible. Interiorly we have the angle of the mouth, and posteriorly we have the anterior border of the ramus. Now the contents involve: in the buccal space we have the buccal fat pad and we have this tension duct. These two are present in the buccal space. Source of infection: from where basically the infection was originated and it spread on to involve the buccal space. So we can have any decayed maxillary mandibular first, second or third molars or premolars, but important point to be noted in case of premolar is that if the root of the premolar goes beyond the attachment of muscle, in that case then it can involve the buccal space. So perforation of the buccal cortical plate above muscle attachment in the maxilla and below in the mandible. Again another important point to be noted here. So spread of infection. Now if the buccal space is being infected and it gets involved, the infection from the buccal space can also spread and involve the other spaces as well. So first of all, the infection can spread along the buccal fat pad to the infraorbital space, to the infratemporal space, the periorbital space, or superficial temporal space. Laterally, it can go on and involve the submesenteric space. Medially, it can go on and involve the pterygomandibular space. And superiorly, it can involve the infratemporal space. So these were the spaces that can get involved secondarily as a result of infection that has been involved the buccal space. So now moving on towards the clinical features. We can see a prominent extraoral swelling below the zygomatic arch and above the inferior border of the mandible. Dimple appearance over the zygomatic arch. We can note here another important point that zygomatic arch and inferior border of the mandible, it remains palpable in the buccal space infection. Now as far as the management is concerned, we can go for the intraoral incision and drainage. We can have the supportive therapy, the hydration therapy, antibiotics, all that we will discuss in another separate video. So we can refer to that video for the management of the odontogenic infection. From this topic, it was all about the buccal space infection. I hope this video will be helpful for you all. Don't forget to subscribe to our channel for more videos and updates. Thank you.